Hello, class. This is our lecture for Chapter 4, Health, Illness, Stress, and Coping. All right, our objectives for these slides. Describe the dimension of the healthy person in relationship to physical and mental well-being. Describe the 5 basic human need categories according to Maslow. Explain illness behavior, the sick role, the impact of illness on the family. Describe Seil's General Adaptation Syndrome. Discuss the concepts of adaptation and homeostasis. Explain the factors that contribute to a person's response to illness. Discuss illness as a stressor. Dimensions of a healthy person. Adaptation to stress affects the whole organism, right? So when someone's stressed, their blood pressure goes up, right? Their blood sugar goes up, their heart rate goes up, right? Healing slows, right? When someone is stressed. People get nervous and shaky when they're stressed, right? So if you're worried about something, if your patient's worried about their illness, right, it's going to affect their whole body, right? It'll change their vital signs a little bit even, right? And if we do interventions as nurses to reduce someone's stress, it is actually going to make them heal better. It's going to make them feel better, right? And oftentimes we use our therapeutic communication skills to help a patient, not have so much stress, not be so worried, right? And with therapeutic communication, we just try and get um, the person to talk about whatever it is they're worried about, right? So if they were worried about a new diagnosis of diabetes, we would ask them an open-ended question, something like, well, what is it that is worrying you about your diabetes, right? Okay, and that might get them to talk about it, right? And if they talk about it, their stress level will go down and they'll feel better. All right, the dimensions of the person: physical, cognitive, affective, behavioral, and social are not separate entities, right? So this goes back to that mind, body, spirit, that holistic nursing that we were talking about um, in the other chapter, right? All right, so as nurses, we not only cure their illness, we see to their physical needs, their cognitive, okay, things like emotion and things. They're affective, right? That's their emotions, right? Behavioral, social. That's things like maybe uh, getting their family or friends to visit them, right? That sort of thing, right? So we treat all these things, right? Because they're all part of a person, right? They're the dimensions of a person, right? Physical, cognitive, affective, behavioral, and social. All right, these dimensions interact, resulting in the development of a unique human being. All right, here is a little picture of Maslow's triangle, and I'm sure you've all seen this before, right? Maslow's hierarchy of human needs, right? So you might want to know these little sections in the triangle, right? Human needs can be organized into 5 levels from the most necessary to the least necessary, right? Now, the least necessary are at the top of the triangle, okay? And the most necessary are at the bottom, right? And a lot of times knowing this triangle can help you solve priority questions, right? You get a question and there's two or three possible right answers. You have to pick the one that is most important, right? And so a lot of times you can use this triangle, okay? You look at the answers, you see where they go in the triangle, and you know that if there's something that goes in the bottom part and the others go somewhere else in the triangle, you know the right answer is going to be the one in the bottom, right? The priority. So if you had a question that says, what do you assess first, right? Um, do you do you assess their emotional needs? Do you assess their religion, right? Or do you assess their heart rate, right? Heart rate is needed for physical survival, and that would be down here at the bottom of the triangle, right? Physiologic. All right, emotions and religion and things like that, they'd be higher up, right? Maybe in this love and belonging thing, right? All right, the theory is with Maslow that you have to take care of things at the bottom of the triangle before you can take care of other things, right? Okay, so um, safety, like having shelter, right? You're not going to worry about that until maybe you're breathing well, right? Until you have food and water, all right? The most basic needs for life. And once you take care of those, right, you're healthy physically, right? You have food and water to survive. Well, then you can go up the triangle and worry about the next thing, right? Safety, okay? Shelter, like a home, right? After food and water, you can worry about getting a home, right? Getting a shelter. All right. So with safety is employment, right? People who are unemployed, they don't feel safe because they think they're not going to have shelter, right? They're not going to have food. All right. So safety includes employment, okay? Believing that you're healthy, all right? That makes you feel safe, and having a shelter or a home, right? Those are safety concerns, right? So you have food and water, you're healthy, you have shelter, you have employment. Now you can worry about love and belonging, right? Okay, and once maybe that's making friendships, finding a spouse, right? Keeping relationships with your family well. Okay, that sort of thing. Once you've met that, you've got those needs taken care of. You can keep moving up the triangle, right? Right? You can work on your self-esteem, right? Confidence, respect. All right, and the highest part of the triangle is self-actualization, right? And they say not everybody gets to the top of the triangle, right? We're lucky if we get here, esteem and confidence and respect, right? Self-actualization means everything is good in your life. There's nothing that needs to be changed, right? So you don't have any disagreements or arguments with anybody close to you, right? You have good relationships with all your family members. You have friends. You have a good relationship with your spouse. Nobody's angry with you. You're not angry at anybody else, right? You're kind of happy, right? And everything in your life is going well and you're taken care of, right? Okay. You have all these things going down the triangle. All right. Plus a little bit better, right? Um, your job is something you enjoy so much, you do it even if they didn't pay you, right? Okay. And like I said, all your relationships with everyone are good. All right. And you're doing what you're wanting to do, right? You don't hate your job, things like that. All right. We all shoot for the top of the triangle. Doesn't mean everybody gets there, right? All right, but most people get here hopefully, right? They feel good about themselves, they have self-esteem, they're confident at their job, they feel like they know what they're doing, right? Other people respect them. They respect themselves, right? Okay. So a lot of us are right here, right? All right. So once again, this triangle, right? Um, Maslow triangle helps us to think about how human needs can be organized, right? There are 5 levels from the most necessary, that's at the bottom, to the least necessary, that's at the top, right? Okay, and the most important is physiologic needs, right? That's at the bottom. Then comes safety and security, right? That's next. Love and belonging, right? That comes next. Self esteem, right? Towards the top. And then self actualization, right? Everything's going well in life. So, illness behavior. Individual actions influenced by the availability and affordability of healthcare, perception of the problem, others' perception of the problem, and the failure or success of self prescribed treatments. All right, so a lot of people, instead of going to the doctor, they try and treat themselves, right? You feel a sore throat coming on, you might take some echinacea, you might go to the store and buy some emergency, right? You might take some garlic. All of these home remedies that people believe, will help them get over illness, will help them not get a cold if they feel like they're coming down with something, right? Um, Vitamin C, right? Different things, right? Zinc. All right, if you feel like you're getting sick and those things work for you, right? You're probably going to try that all the time when you feel like you're getting sick, right? Other people might just go to the doctor as soon as they think they're getting sick, right? Try and get an antibiotic or some Tamiflu, right? If it's a virus. Um, right? And so that can change your behavior. If the home remedies work for you, it'll change your behavior by not having you go to the doctor, right? All right. Okay, individual actions influenced also by the availability and affordability of healthcare, right? If you don't have money to go see the doctor, if you know that walk-in clinic is going to charge you $200 just to look at you, right? And they might not even send you home with anything, right? They think it's a virus, they might not. Um, if you think you can't afford that $200, right? That's going to influence your behavior as well. You're not going to go. You're going to try and tough it out. You're just going to let yourself get sick and, let um, your body's immune system, right, work, right? You might not get better as fast without antibiotics, but you kind of think, oh, I get sick all the time, and my body's going to take care of it, right? And I don't want to spend the $200, right? People could be thinking like that, right? All right, perception of the problem. If you don't feel well and you think it's just a cold and you think your body's gonna just fight it and you're gonna get over it, that could change your behavior, right? If you think it's not very serious, you're not going to go to the doctor. But if you think it is serious, you think that cold is turning into pneumonia, well, then that's going to make you go to the doctor, right? So your perception of the problem is going to change how you behave, what you do. Are you going to go to the doctor or are you not? Others' perception of the problem, right? Sometimes we think we're getting really, really sick and we want to go to the doctor. But our family members might say, no, you're being a wimp, tough it out, right? There's not that much really wrong with you, right? So someone else's opinion can matter. Could be the opposite. You think you're not sick, you don't want to go to the doctor, and maybe your spouse is saying, no, I think you're really, really sick. You have a fever, right? Your skin color doesn't look good. You're pale. I really think you should go to the doctor, right? Okay, it can go both ways. So someone else's perception of your problem, right, might change your behavior, right, about what you're going to do about your problem, right? You're either going to go to the doctor or not, or maybe you're going to use self-prescribed treatments, right? Home remedies, or you're not. Okay, so it will change your behavior, right? How others think, um, others' perception of your illness, right, or your problem. All right, there are um, categories of people who take no action, right? They're not going to go to the doctor. They're not going to do self-prescribed treatments, right? Like herbal remedies, maybe even just drinking chicken soup because people feel like that helps with things like colds, right? So there are people who take no action. They just don't do anything, right? If they had something small like a cold and they didn't do anything about it, they probably would get over it, right? It's not a problem with small things. But people who take no action, all right, when it's a bigger problem, right? It's something like diabetes. That could be an issue, right? Some people, they're told they're diabetic and they just don't want to take care of it. They don't want to take their medicine. They don't want to check their sugars. They don't want to change their diet. They just don't take any action, right? Okay, or they have high blood pressure, right? The doctor tells them you have high blood pressure. You need to be on these blood pressure meds, right? You need to change your diet. You need to exercise, right? And they don't, right? They don't take their medicine and they don't change anything about their behavior, right? All right, so there is that class of people who don't who take no action, and there are groups of people who take counter action. All right, this is sort of even worse than people who take no action, right? Counteraction happens when you're told you've got a disease like diabetes or blood pressure, high blood pressure, and instead of doing nothing about it, you actually do things that will make it worse, right? So, I have seen diabetic patients who want to deny that they have diabetes. They want to tell themselves the diabetes doesn't matter, it's not going to hurt them. And so, sort of to convince themselves, right, that everything's okay and relieve their stress, basically, uh, instead of changing their diet and eating less, maybe sugary foods, right, they'll actually eat more, right, to prove themselves that diabetes isn't going to do anything to them, right? Or if they have a high blood pressure and they've been told to cut back on their salt, they'll actually eat more salty foods, right? They're trying to convince themselves on a subconscious level, right, that there's really nothing wrong with them, that they don't have to worry about it, right? And that relieves their stress. They might feel better, might feel less stressed, but they're actually doing themselves harm, right? Okay, versus people who take no action, right? At least they're not trying to make it worse, right? They're just not doing anything about it. With counteraction, they're purposefully doing things they know on a subconscious level, right? It's going to make things worse, but at the same time, they're trying to convince themselves that there is no problem, right? So they do things that are the opposite of what you should be doing, right? If you should be eating less sugar, they're eating more. Should be eating less salt, they're eating more, right? And that kind of helps them prove to themselves that they don't have a problem, right? So that's counteraction. All right, the sick rule. All right, the sick rule allows time to recover from the illness, right? When we were kids, we got to stay home from school if we were sick so that we could rest, right? Our parents gave us time to recover, right? When patients cannot get well on their own, others must care for them, right? So, imagine someone with a broken leg, right? Um, they probably can't um, do all the things they normally do, right? And so someone has to take care of them and maybe help them with those things, right? All right, a broken leg, a broken arm, some other illness, right? Maybe that broken arm means they can't make meals for themselves, right? And someone has to come in, right, and help prepare food for them, right? If got a broken leg, maybe they need help walking to the restroom, right? Okay, so when people cannot get well on their own, others must care for them, right? All right, whether they get well or not, right? Imagine somebody that's not going to get well. All right, someone who's aging and has maybe Alzheimer's, right? They're not going to get well from that. There's no cure, and their ability to do things for themselves decreases with time, right? And so people have to do more and more care for them, right? All right, the sick role temporarily exempts from social responsibilities so that they can concentrate on getting well. Once again, when we were kids, right? If we said we were sick, we got to stay home from school. An adult who's sick, maybe they call into work sick, right? They don't have to go to work. Okay. If the family expects that the family will, say, go to church or something like that, and someone is sick in the family, maybe they get excused from church. They don't have to go. They don't have to walk or drive to church, right? Okay, so someone that is in the sick role, right? They get exempt from some social responsibilities, right? School, work, church, maybe even volunteering, right? Because they're sick. All right, people who are sick want to get well and therefore should seek the help of healthcare professionals and cooperate with prescribed healthcare regimes, right? So usually if we're ill and um, we think antibiotics will help us, right? We want to go to the doctor. We want to get those antibiotics so that we get better sooner, right? And feel better sooner and be able to go back to our daily lives sooner, right? Not a lot of us like to, uh, you know, feel sick all day and be in bed and not be able to do anything, right? All right, so sick people usually want to get better and they seek the help of healthcare professionals. Some reluctance to give up the sick role because of the tension they get or to avoid work, right? So on one level, we all want to get well. Doesn't mean we want to give up the sick role, right? Even if we start feeling better, we might not let people know that, right? We might like being off from work or school, right? Or not have to do some of the chores that we normally do, right? Especially kids, right? If they're sick, they're not going to maybe tell mom right away that they feel better because they know when they feel better, they're going to go back to school, right? So there is some reluctance to give up the sick role, right? If you're enjoying part of it, right? You don't enjoy feeling sick, but you might enjoy um, people bringing you things like chicken soup and not having to go to school or work, right? And people telling you they hope you feel better, right? All of those things, right? So sometimes there's reluctance to give up the sick role. All right, the sick role has its advantages, right? You get out of some social responsibilities. But of course, when you're sick, you don't feel well, right? So we all want to get better. All right. Okay, effects of illness on the family. Three factors. All right. Identity of the member of the family who's ill, seriousness and duration of the disease, social and cultural customs of the family, right? So all of these things, they influence, how an illness is going to affect the entire family, right? All right. Say someone is diagnosed with diabetes or high blood pressure, right? Something like that. Okay. Um, Maybe it's the father, right? The breadwinner, right? The identity of that family member, right? Might change a little bit, right? If their family thought of them as, strong, invincible, able to beat anything, and they thought that about themselves, and all of a sudden they've got this illness that's not going to go away, right? Diabetes or high blood pressure, and now they have to take medicine and they have to change their diet and they have to exercise. Um, right, that could change what they think about themselves, right? What their family thinks about them, right? Um, and can change the way maybe they feel as a person, right? They don't feel invincible anymore when they've got um, an illness that's not going away, right? Something they can't beat. All right, seriousness and duration of the disease, right? If it's something that's deadly, of course your family is going to be very stressed, very worried, right? If it's a chronic condition, same thing, even things like diabetes. It may mean a lot of changes for not only the person but their entire family, right? If families eat meals together and the person has to change their diet, right? That means the whole family's diet's going to change, right? Because they're going to be eating some of what is being made for the person with the illness, right? Okay. If they're supposed to eat less red meat, less uh, fatty foods, well, and then at the dinner table, everyone's going to be eating less red meat, every less fatty foods, right? All right. All right. And if it's a serious disease, whether it's chronic, right, like diabetes, high blood pressure, COPD, or a short disease that's very serious, something that's uh, going to cause a person not to be around for very long. All right, things like cancer and things, right? Okay, the worse it is, the more likely the person's not going to live very long, that sort of thing. It's going to put a stress on the family, right? All right, and social and cultural customs of the family, right? So every culture, they have different ways of dealing with things, right? Dealing with illness, right? That could mean how much help your family's going to give, right? Whether someone in your family will take over your role if you become too sick, right? In some families, according to culture, maybe if it was a male, his wife wouldn't be expected to fill the role maybe of uh, you know economic provider, right? It wouldn't be expected that the wife would get a job, right? Maybe extended family would help maybe with finances and things, or a male son would go and work and fill in, uh, bringing income to the family, right? Same things with maybe females, right? If a female couldn't, if they had the caregiver role, in some cultures, a man wouldn't be expected to now start cooking and taking care of the kids and doing the housework, right? But in some cultures, yeah, if the male gets sick, no problem for uh, the woman or the wife to go out and start working, right? Right. In some cultures, if the woman no longer, if she was the caregiver and she no longer can do that, maybe because she does have to work and bring in family income, right? You know, it wouldn't be a problem for the husband or the male partner now to pick up the role of caregiver, right? Bathe the kids, feed the kids, do the housework, right? Okay, so how the family functions, all right. is influenced by the culture and customs of the family, right? Frustration, anger, and grief must be dealt with so that all members of the family can function at their highest potential while providing care for the sick member, right? So if we can help the family with their stress or with what's bothering them, right? The family's going to function better and they're going to be better able to help the person who is ill, right? Get over the illness, deal with the illness, that sort of thing. All right, illness does not affect individuals in isolation. Rather, it has an impact on the entire family. Right, the stress response, right? We're talking a lot about stress today, right? Because when you're ill, if you're in the hospital, you're feeling stress, you're under stress. All right. And you guys, you might not have heard a lot about your sympathetic nervous system, right? And that's your fight or flight, right? That's, you might have heard in anatomy class, they give the example of you're either going to run away from a bear or you're going to fight it, right? That's the fight or flight. And if you're running away from a bear, what symptoms do you have, right? Well, your blood pressure goes up, your heart rate goes up, your eyes dilate, right? You sweat, right? Um, so this sympathetic response, right, which is called the stress response, it happens whether or not you need to run away from something or fight something. It happens when you're just worried. You could be sitting in a chair, worried about your family member, worried about your position at work, worried about a test that you're going to have to take at school, right? You don't have to be running away from something to get a stress response, right? And when people are ill, even if they're just lying in bed in the hospital, this stress response is kicking in, right? It'll mean that their blood pressure is probably going to be higher, right, than usual while they're in the hospital, right? Because they're going to be afraid, right? And being afraid is going to cause the stress response to happen, right? Because they're going to be stressed. All right, so they call this the local adaptation syndrome, okay, and the general adaptation syndrome, right? What's the difference between local and general? All right, when we say local, we're usually talking about just one body part, right? And when we say general or generalized, we're usually talking about a response all over the body, not just in a part, right? Not just in a part of a body. All right, so we'll talk about the local adaptation syndrome. All right, this is a short-term localized response to a specific stressor that restores a body region or part to homeostasis, right? Okay, and homeostasis is a word that means your body always tries to bring things back to normal level, right? So if your blood pressure's high, your body wants to bring it back to normal, right? Or your heart rate's high, your body wants to bring it back to normal. If you're losing blood, right, and it affects your blood pressure, your body wants to bring your blood pressure back to normal, right? And it wants to just restore, right, whatever changes happen because you were bleeding, right? That might be making more red blood cells, right, after you've been bleeding a lot. All right. Okay. Holding on to more water in your body to bring up your blood pressure, that sort of thing, right? All right, but a good example of a short-term localized response might be something like you cut your finger while you're chopping vegetables, right? In the kitchen, right? Making dinner. Cut your finger. Your localized adaptation syndrome response would start to happen, and your body would immediately try to restore homeostasis, right? So you cut your finger and you have a little bit of blood coming out of your finger, right? Your body's going to want to stop that bleeding, right? So an example of local adaptation syndrome would be blood clotting, right? Okay, so you cut your finger, you're bleeding, now your blood's going to clot. White cells are probably going to go to the site of that wound to stop you from getting infection, right? And you're going to feel pain there because your body doesn't want you to keep hurting that area, right? It wants you to protect it. So you're going to feel pain and you're going to have inflammation, right? And the reason you're having inflammation is all of your little capillary blood vessels are sort of opening up so that they can get the blood clotting things to that wound, things like platelets and fibrin, right? Things that will make a scab, right? Stop you from bleeding. All right, those little blood vessels are also opening up, right? Making you inflamed, right? To get white cells and things to that wound, right? All right, and your wound, as soon as you got that scab starting to form, your body's going to start healing that wound, right? Okay, in a week or so, you know, you might not even notice that you had a cut on your finger, right? If it's healing very well and it's closing, right? It's not hurting anymore. It's not inflamed anymore, right? Your body's going to heal that wound and you're going to be fine, right? And then the local adaptation syndrome will be over, right? Because you'll be healed now. All right, general adaptation syndrome, right? This is going to be more systemic or all over the body, right? All right, so general adaptation syndrome is a physiologic response of the whole body, right? The whole body, it's systemic, right? It's all over your system. All right, so it's going to involve the whole body, right? It involves primarily the autonomic nervous system and the endocrine system, right? And so we just talked a little bit about one part of your autonomic system, right? Your sympathetic response, your fight or flight, right? This is going to have systemic or all over body um, symptoms, right? Okay, so it's going to be things like your blood pressure going up, your heart rate going up, your sweating, your liver is releasing more glycogen, which turns into glucose, right? So you'll have more energy, right, to run away from a bear if you needed to, right? So it involves your autonomic system, right? The two parts of that are your sympathetic and your parasympathetic, right? We're going to talk a lot about those two systems in some of our other chapters in MedSurg, right? But the sympathetic, that's your fight or flight, right? That's what's kicking in when you're stressed. All right, and then your endocrine system. Now, your autonomic system has an effect, right? It works with your endocrine system, right? And your endocrine system is the system that releases chemicals that are going to give you lots of energy, right? And they're going to help you run away from a bear, right? So that's things like, um, you know, adrenaline, right, which gives you a lot of energy. It's also boosting your blood pressure and heart rate, right? It's giving you strength and all that energy to run away from something. And that's all well and good if you actually are running away from something. But when you're just ill and you're lying in a hospital bed, all that release of things like adrenaline, they're not really helping you that much, right? Okay, they're just raising your blood pressure and your heart rate and making your sugar levels go up, right? And making you feel shaky and nervous, almost like you've had too many Bulls or too many cups of coffee, right? You feel a little shaky and nervous. All right. So in some ways it helps us, in other ways it might not be that helpful, right? We don't want tachycardia, we don't want hypertension, right? Being some of the factors we have when we're stressed, right? All right, the general adaptation syndrome, often referred to as the neuroendocrine response, right? Okay, neuro meaning our brain, right? Our nerves and our brain is mostly nerve tissue, right? So neuro for brain, and you guys, part of our autonomic system is in our brain, right? And part of our endocrine system's in our brain as well, right? Our pituitary, right? So this adaptation involves our nervous system, right? Our brain and spinal cord, and our endocrine system, which is that system that releases hormones and things, right? Things like epinephrine, adrenaline, okay, those sorts of things. All right, so it's sometimes called the neuroendocrine response, right? That general or system wide adaptation syndrome. Now, some of the same things are going on in the local and the general, right? Okay, signs of an injury are going to cause, locally, like say if you cut your finger, warmth, redness, and pain, right? Now, something very similar is seen in the generalized system, right? If you're sick with maybe a cold or something, right, that your body's perceiving that as something trying to give you an energy, um, something trying to cause you harm, right? You'll get that redness and warmth just like you would with a local, right, when you cut your finger. Only the warmth now, if it's system wide, that's going to be a fever, right? And the redness might be a rash, okay? So some of the same things are going on, just if it's local, it's just your finger because maybe you cut your finger. If it's general, it's all over your body because maybe you have a cold, right? Or you have um, pneumonia or something like that, right? And your whole system is reacting to it. All right, adaptation to stress, essential to maintain health, right? So those two adaptation syndromes we just looked at, right? They are essential to maintaining health, right? If you cut your finger, you need that local adaptation syndrome to stop you from losing blood, to make your blood clot, right? To bring white cells to the area so you don't get infection, right? Constructively coping with stressful situations, right? This is kind of cognitive, right? See this little guy with the wheels turning in his brain, right? Um, we have physical responses to stress, right, with our fight and flight. Um, but we also have ways of calming ourselves down, right? Constructively coping with stressful conditions, right? So if we have learned from past experience, right, how to calm ourselves down when we're stressed, how to make our heart rate go down, right, how to relax, right, that's going to help us adapt to the stress, right? Bring our blood pressure down, slow our heart rate down. All right, so for some people, that could be things like reading a book to calm themselves down. Some people use meditation. Some people do breathing exercises, right? Some people just think positive and talk about things positively, right? They put a good spin on things, right? Even when they're talking to other people, right? Because they're almost helping convince themselves, right, that things are going to get better. All right, so whatever works for our patient to help them reduce stress, we're going to facilitate that, right? If reading a magazine or a book helps them, right? We're going to go find those things, right? We're going to find some magazines, newspapers, a book if your hospital has a library, right? Okay, if it's meditation, we're going to help with that. If it's music, right? If music helps them, we're going to help them um, find a way to listen to music, right? Even if it's just turning on the television and finding a station that plays music, right? All right, a lot of time that's called distraction, right? You do something else so you don't think about the stress, right? So you read a book, you listen to music, you might even watch a television program, right? And that might reduce your stress because you're not thinking about your illness or whatever's going on, right? That even works for pain, right? If you're watching a television show and your concentration is on that and not on the thing that's hurting you, right? Sometimes you won't think about the pain, and therefore you won't be feeling the pain as badly, right? With distraction. All right. Adaptation to stress depends on accurate appraisal of the stressful situation and effective coping, right? Now there are some people that think a small thing is worse than it is, right? And they get overstressed, right? I suppose the same could happen. They could think a big thing is just a small thing, right? All right. But if they're going to adapt to it, whether it's big or small, they have to accurately appraise the situation, right? Okay, they have to know what's going on so they can, they can protect themselves, right? They don't want to aggravate maybe a surgical wound by doing too much activity, that sort of thing, right? All right, so they have to accurately appraise their situation. Okay. Adaptation to stress can lead to physiologic and psychologic well-being. Remember, because stress affects things like our blood pressure, our wound healing. It affects our emotions, right? If we're really stressed, we're going to feel maybe afraid. We're going to feel sick to our stomach. All right. So we want to learn to adapt to stress, right? If we're adapting, um, it'll make everything in our system, right? Physiologic and psychologic much better, right? So it can lead to physiologic and psychological well being, right? Okay, homeostasis. That's a word that means we're going to keep everything still and the same, right? Right? You guys, this word, it's got a prefix and a root, right? Separated by an O, right? So home means same, right? Homeo, same. And stasis, keeping still or keeping steady, right? So this word means we're going to keep everything the same and we're going to keep it steady, right? All right, so homeostasis, the tendency of the body to maintain stability of its internal environment, right? So even when you're not sick, right, your body is always trying to keep you within normal levels, right? So even when you're not sick, your body's trying to keep you at the same temperature, right? If you go out into the cold weather, you're going to shiver, right? You're going to move around. You're going to try and create heat for yourself, right? And that's your body's way of keeping your temperature on the inside of your body the same. If you go out on a hot day, right, you're gonna sweat. You're not gonna feel that great if you're too warm. You're gonna seek the shade, right? You're gonna try and cool down, right? But sweating and things like that, that's your body's attempt once again to keep your temperature the same, right? So shivering, sweating, part of your body's adaptation to stress, right? trying to keep you in homeostasis, trying to keep your body temperature stable, right? Okay, same thing for your blood pressure, right? That sort of thing. Every system in your body's trying to keep it within normal range, right? Keep it steady, keep it the same. All right, the body adapts to internal and external changes in the environment, right? External changes would be things like, you know, being hot outside or being cold in the winter. All right, but there are internal things as well, right? If you're sick and you're having a fever, right? Um, right, your body's going to do some things, right, to make sure the internal part of your body doesn't get uh, too warm, right? Because that affects how enzymes and things work in your body, right? And if you get too warm, it could cause some really bad problems, right? All right, so the body adapts to internal and external changes in the environment, adjusts to changes, and maintains equilibrium or homeostasis, right? So if you're running, for instance, right, playing sports, you're running, and your muscles are producing a lot of heat, right? That's internal, right? Uh, your body's going to do things to keep you cool, right? Once again, by sweating, all right, and vasodilating and things like that. All right, continual adaptation and change in the internal environment are essential for the organism to exist in the external environment, right? All right, so we don't like a lot of changes on the internal environment, right? Inside your body. We want to keep your temperature the same. We want to keep your blood pressure and your heart rate the same. We want to keep your fluid volume the same, right? We want to keep your electrolyte levels the same, right? We want to have, uh, sufficient blood in our blood vessels and things like that, right? So our body is always trying to keep us in homeostasis, keep us the same. Okay, coping with illness. Factors that affect coping with illness include age, cultural beliefs, spirituality, self concept, family and community resources, and emotions. All right, now, um, age has a factor in coping with illness because the longer you live, the more illnesses you're going to have, right? And you're going to learn ways of coping with them, right? Um, even the pain and things that comes with illness sometimes, right? The more you experience um, any stressor, right? Illness, pain, whatever the stressor is, you kind of build coping strategies, right? You try different coping mechanisms and uh, whatever works, you kind of maybe try that again, right? Okay, so things like, distraction, um, you know, uh, using meditation, speaking positively, having positive thoughts, right? As you learn good coping mechanisms, you deal better with stresses, right? All right, cultural beliefs, right? Your culture can sometimes influence how you deal with stress, right? Some cultures are very stoic, and that means they don't show a lot of their emotions. They don't show when they're in pain. They don't show when they're worried, right? And some cultures are very, very stoic. They don't like to show things, right? Okay, maybe that helps them cope, right? Maybe that's their coping mechanism, right? Some of the Asian cultures are very, very stoic, right? Um, I think your book talks about the Japanese culture, how they're very, very stoic. They don't like to show that they're in pain. They don't like to show when they have emotional stress, that sort of thing. German culture also very stoic, right? All right, that might help them cope. In some cultures, they encourage you to show emotion. Okay, they encourage you to express your feelings, right? And sometimes that's even based on gender, right? Maybe females are uh, expected to show their feelings, show that they're in pain, showing that they have emotional stress, and maybe the males aren't, right? I used to talk about Hispanic culture, right? Because your book says they are more likely to show emotion, show that they're in pain. But then some of my students say, no, that's not true. The males are taught not to show those things, right? Um, so I guess uh, in some cultures, it's also based on your gender, right? How you are expected to cope with illness, with pain, with different stressors, right? Okay, so our culture can affect how we deal with a stressor like illness, right? Spirituality can affect how we cope with an illness. I think I talked about before how some cultures, and I'm thinking about the German culture and um, you know some of the spirituality that they have, right? Where they think um, God's given them the illness and they're expected to experience it, right? Um, so they're expected to experience the discomfort, right, of the illness, right? Um, so they might not want things that just help them feel better physically, maybe like pain medicine and things like that, right? They would want things like antibiotics and things, all right? Um, but if we have patients who um, do have that belief, right? We're not going to really concentrate so much on things like pain, right? Um, because they want to feel the pain, but we're still going to concentrate on getting them better, right? Making sure they get their antibiotics, right? Making sure that we get them up walking, right? So that um, they don't lose any muscle strength or they don't get fluid in their lungs, right, from inactivity, right? Okay, other cultures, people feel better when they do things like pray, right? Um, whatever God is believed in, right? A lot of people, they get less stressed when they're praying, right? Prayer can be a real effective way of dealing with illness and stress from illness, right? So, spirituality can affect how we heal, for instance, right? If someone believes in prayer, right, and they're praying and that makes them less stressed, that's going to help them heal quicker, right? And they've done studies that, people who pray while they're ill actually tend to get better quicker, right? All right, self-concept, right, can affect how you deal with an illness, right? If you consider yourself a strong person that can beat anything, right? You're going to be very confident while you're ill, right? And that's going to relieve your stress. That might actually help you get better, right? All right, but if you're someone who thinks they can't handle things, right? Then they're going to be more stressed and that might cause them to take more time to heal from something, right? So self concept affects how you cope with illness, right? Okay, family and community resources, right? If you have a supportive family, that can relieve your stress and make you get better quicker, right? Or if you have a community that supports you, right? You have friends or you have people from your church who come and visit you and make you feel better, right? That can help you cope with illness. Right? Emotions affect how you cope with illness, right? Because your emotions affect how stressed you feel, right? All right. Right. If you're depressed about things, right, that'll make you feel more stressed, right? That once again, that can slow your healing. All right. If you're a positive person, right, if you're sort of happy even when you're ill, right, you'll probably get over the illness faster. You'll heal faster. All right, illness as a stressor, right? When we're ill, it's a psychological stressor because we don't feel well. We might have some pain, headache, right? A body part that hurts. So it's a psychological stressor. But illness is also a physical stressor, right? Um, your body has to use resources and things to heal you from an injury, right? To fight an infection, right? Your body has to use energy, right? And things like your fight or flight kick in, right? With both kinds of stress, right? Your sympathetic system kicks in, right? Uh, so humans can't go through life without stress, right? Almost everything we do puts a little bit of stress on us, right? We go to school, maybe we feel stress, right? Because of the studying we have to do. When we go to work, maybe we feel stress. We're under pressure to get things done, that sort of thing, right? That's a psychological stressor. All right. Even when we exercise in the gym, right? That's a stress on our body, right? And our body adapts to it, right? Okay, so humans can't go through life without stress. There's internal and external factors triggering stress, right? All right, so external things like maybe, you're worried about school, you're worried about your tests, right? And internal things like maybe you have a bacterial infection, right? And that's giving you a fever, right? Okay, so we have internal and external factors that trigger stress, right? Okay, environmental factors can cause stress, right? Like being too cold, being too hot, um, you know, being short of breath because maybe there's too much smoke in the air, right? Having allergies to pollen and things, right? All right, so environmental factors cause stress. Life changes cause stress, right? If you're moving from a home, right? If you're getting divorced, things like that, right? So life changes. If you're getting a new job, right? That's stressful. All right, physiologic or emotional illness contributes to stress as well. All right, question one. Which is not a way that affectional, emotional needs are satisfied, right? A is memory, B is love, C is security, D is care. All right, I'll give you a second to think about which one would you choose. All right, and if you chose A, that was the right answer, right? Memory is not a way that affectional emotional needs are satisfied. Affectional emotional needs are satisfied through love, security, approval, respect, support, and care. All right, and that kind of makes sense, right? Uh, affectional emotional needs. Even if you didn't know what affect meant, affectional, you know what emotions are, right? Emotional needs, right? And what things pertain to emotion, right? Love, that's an emotion. Security, right? That's sort of emotional. And care, right? When you care about someone, that's an emotion. When someone's caring about you, that's emotional. All right, but memory, right? That's not an emotional thing, right? All right. Right, you're trying to remember what formula to use to calculate a drip rate, that sort of thing, right? It's not an emotion. Um, right? So, love, security, and care are. Now, we've talked about the word affect, affectional, right? That's talking about affect. Remember, affect is how you physically show your emotions, right? It's things like smiling or laughing or crying, right? So, affectional emotional needs. All right, this is the second part of the slides, right? And if you haven't had a lunch break or even a 10-minute break, right? This might be a good time for a pause. All right. But once again, feel free to pause the video um, whenever it's convenient, like for your 10-minute breaks and your lunch, right? All right. But this is the second half of our slides, right? Lesson 4.2. All right. Our goals for the second part of the slides. Describe the personal factors that impact the response to stress. All right. Describe factors that affect coping with illness. Provide examples of adaptive and maladaptive coping. We've been talking about some adaptive ones. Remember, adaptive is positive. Mal, right? Mal means bad in Latin languages, right? Maladaptive means bad coping mechanisms, right? We've been talking about a lot of adaptive ones, a lot of good ones. Things like talking with friends, all right, distraction with things like television, right? Those are good ways of adapting to stress if they work for you, right? All right, maladaptive, that would be things like, maybe drug abuse, something like that, right? All right, define defense mechanisms that may be used to cope with stress or anxiety. Identify conscious strategies used to deal with unfamiliar situations. Describe three maladaptive coping strategies, right, including helplessness, powerlessness, and denial. All right, describe the purpose of Healthy People 2030. Identify nursing interventions to promote maximum possible health along the health illness continuum. All right, coping strategies. Right, we've been talking about some of them, right? Things that you do maybe to help yourself calm down when you're stressed, right? Talking with people, watching television, reading a book, that sort of thing. All right, but coping strategies, they're self regulatory processes by which people manage the response to stress, right? So when you're using coping mechanisms, you're trying to make yourself feel less stressed, right? You're trying to make yourself feel calmer, right? By doing those things we talked about, right? Watching television, talking with friends. All right, coping behaviors, right? They can be adaptive or maladaptive, right? Adaptive means they're good, and right? Mal means bad in Spanish, right? Maladaptive, right? Bad adaptation, right? Are things that are bad, right? So adaptive, right? Talking with friends, listening to music, that would be adaptive. That's good, right? Maladaptive, yelling at people, using alcohol or drugs, right? Those things would be bad or maladaptive. All right, coping strategies can be conscious or unconscious, right? If they're unconscious, a lot of times they are defense mechanisms, right? Things that you're doing unconsciously to defend yourself against feeling the stress, right? All right, so here's some different defense mechanisms, right? Things that make us feel better, all right, when we're stressed, right? All right, so the first one here is compensation, right? Now, sometimes um, when we're angry or we're feeling stressed, we might lash out and do something to somebody else, right? And then that will make us feel stressed because now we'll feel guilty, right? So, for instance, if we were feeling stressed and we yelled at our spouse, right? And then we cooled down, right? And we didn't feel as stressed anymore. And we thought about what we did. And now we're stressed because we feel guilty, right? So we might do something to make that person that we yelled at feel better. And if we can make them feel better, we're going to feel less stressed from the guilt, right? So, if one spouse yelled at the other and then cooled down, maybe they'll go out and buy some flowers or something, right? To give to the spouse that they yelled at, to make that spouse feel better. And then they won't feel as guilty. And, right, they'll get rid of the stress of feeling guilty, right? All right, another example is if, a child got upset and maybe kicked their dog, right? And then the child calms down and they think, oh no, now I feel terrible because I kicked my dog, right? Um, they might call that dog over and pet it really well, or they might take it for a walk, or they might give it a dog treat, right? They're kind of saying, I'm sorry for kicking you, basically, right? But they're going to do something they think will make the dog feel better, right? And so they're compensating the dog for the harm they did, right? Same with the spouse, right? Give the spouse flowers after um, saying something unkind to them or yelling at them, right? You're compensating that spouse with the gift of flowers now, right? You're trying to undo the damage that you did, right? So that's kind of compensation, right? Now, denial, right? Denial that there's anything wrong, right? All right, so I think I've talked about before. Sometimes when someone has an illness, they don't want to feel the stress of knowing that they have that illness, so they deny that they have it, right? So the doctor tells them they have high blood pressure. They'll say, no, I don't have high blood pressure. They might even seek a second opinion, right? To prove to themselves that they don't have high blood pressure, right? Okay, so they won't believe it, right? They'll deny it, right? And if they don't believe there's something wrong, then they don't have to feel the stress of that thing, right? That is wrong, right? So there's denial. Now, usually denial is a maladaptive coping mechanism. All right, next up, displacement, right? This is a word that means if you can't express um, your emotions to one person, because maybe they're your boss or there's some reason you can't, um, you know, sort of vent your frustration, right, on someone that you're angry with. You choose another person or another object to vent your frustrations on instead. So, for instance, if you're angry at your boss and you can't yell at your boss because you're going to get fired if you do, right? You might go home and yell at your child or your wife or your pet, right? And even though you're not angry with those people, um, you're releasing that frustration on them, right? So you may not be angry with your wife, but you can't yell at your boss who you are angry with, and so you're just angry, right? You might yell at your wife, right? You're displacing your anger. You're putting your anger on one person, right? You're putting that anger onto another person, right? So mad at the boss, can't yell at him, yell at your spouse, child, or pet, right? That's displacement. All right, identification. Your book says that this involves the emulation of admirable qualities in another to enhance one's own self esteem. And it gives the example of a child dresses and uses mannerisms similar to those of a rock star, right? Okay, or might be, if they like sports players, right? They might dress in that person's team colors, things like that, right? All right. Right. If they don't feel confident in themselves, they'll try to act like someone they do think is strong and capable, right? So they'll emulate somebody else, right? A singer, sports personality, that sort of thing. All right, rationalization and intellectualization. The use of logic, reasoning, and analysis to avoid unacceptable feelings. For example, a student fails to complete an assignment correctly and rationalizes um, subsequent feelings of incompetence by complaining about the teacher's expectation for the assignment, right? All right, so, if a student's stressed because they're taking a test, right? And maybe maybe they don't study for it, right? Right? And then they take it and they don't do well, right? They're gonna rationalize, give a reason, right? Give a reason why they didn't do well. And instead of looking at how much they studied, right? They'll say, well, it's the teacher's fault, right? Uh, the teacher made the test too hard, or the teacher didn't tell us everything that was going to be on the test, right? All right, instead of looking at why they didn't do well. Now that is probably not a good coping mechanism, right? Because if they're doing that, they're not going to think, well, okay, I got to study harder for the next test, right? If they think it's not them, it's the teacher, right? Um, it's going to cause them not to fix the problem, right? Right? It's not going to cause them to study more. Right? Now, stress that you feel because you're worried about a test, sometimes the stress itself can be positive if it makes you try and solve the problem, right? So if you're stressed about a test and that stress makes you study more, that's a good thing, right? All right, but using rationalization and intellectualization sometimes isn't always good because it doesn't help you fix the thing that you're stressed about, right? You're stressed about a grade, right? So, um, doing something to help you get a better grade, right? That would work better than um, just thinking, okay, it's nothing with me, right? Somebody else. Someone else is not doing their job, right? All right, next one, introjection. Okay. Introjection is internalizing or taking on the values and beliefs of another person. For example, a child takes on the values and beliefs of the parent, right? And that's normal, right? Introjection is normal. We usually learn our values and things from our family and our parents, right? All right, and that can help relieve stress, right? If you are feeling stressed about something and you look at your parents, you see how they are handling it, right? And you try to do what they're doing, right? You're taking on their values, right? Things that they're saying while the stress is happening, right? That can help you feel calmer, right? So introjection is sort of good. All right, isolation. Okay, isolation, the separation of emotion from an associated thought or memory. For example, a man appears apathetic as he discusses a firefight in which he participated uh, in Vietnam, right? Okay, so isolation, you kind of don't think about the thing that is stressing you. You remember it, you can talk about it, But you don't try and actually feel any emotions when you're remembering it, right? So you just kind of talk about it, right? Um, Not very emotionally, almost stoically, right? Right? You're trying not to conjure up any emotions, right? That's trying to isolate the memory, right? All right, projection. Transferring an unacceptable feeling or impulse to another. For example, a partner who is jealous of her significant other accuses the partner of being jealous, right? Okay, so you're actually projecting something you feel about your behavior, right? Your because it makes you maybe makes you feel guilty, right? You project what you're doing or feeling onto another person, right? All right. So if you were unfaithful and you felt guilty about it, right? You could now start to believe, hey, that your spouse is also unfaithful, right? And that would relieve you of your guilt maybe and make you feel less stressed. All right. Our next one is reaction formation. All right. Reaction formation, avoiding unacceptable thoughts and behaviors by expressing the opposite thought or behavior. For example, a patient who unconsciously hates his father continually says how great his father is, right? All right, so that's reaction formation, right? Feel guilty about not liking your father, right? You'll start saying how wonderful he is, right? Kind of relieves that guilt, right? Makes you feel less stressed. Regression. This is something when stress causes a person to go back to a previous behavior, right? So if we were talking about a child, maybe there's a child that's going into the hospital and they're walking and they're talking and they're toilet trained, right? But they're in the hospital now and they feel very, very stressed, right? So they might go back to a previous behavior. They might start wetting the bed, okay? They're walking, but they might, put themselves on the ground and start crawling, right? They'll do a familiar behavior, maybe like crawling, right? Because it makes them feel safer, right? Okay. If we're talking about an adult, if an adult is stressed because they've just found out they have an illness, right? And they're usually very adult-like, right? Respectful, right? Not a problem causer, right? They might regress as well to a previous behavior, right? So they might start acting childish, right? Okay. You know, uh, Demanding attention, things like that, demanding uh, things they never would have asked for, right? Okay. So they become more childlike, right? If they're an adult. Okay. The example your book gives, it says, regression withdrawing to an earlier level of development to benefit from the associated comfort level of the previous level. For example, a child starts sucking their thumb when her new brother comes home from the hospital, right? Sucking the thumb, that's going back to a behavior that they've left, right? They stop sucking their thumb, they're stressed, they go back to sucking their thumb, right? All right, repression, an unconscious defense mechanism in which unacceptable ideas, impulses, and memories are kept out of consciousness. For example, a woman cannot remember a sexual assault, right? So, a lot of times when something really horrible happens to us, We don't want to remember it because every time we remember it, we feel the stress, right, of what happened to us, right? And so people want to repress the memory, right? Okay, so if they got sexually assaulted, they're not going to want to remember it. In fact, they can't remember it if they repress it. And if they can't remember it, then they can't feel the stress, right? And it's a defense mechanism, right? It's a way to stop the attack of that stress, right? They can't remember it. All right, somatization, right? Okay, somatization is the transfer of feelings to body parts so that the person's feelings are expressed in the form of a physical symptom. For example, a woman who has experienced um, intolerable internal conflict develops a physical complaint of pain in the wrist that cannot be explained by diagnostic measures. All right, so said more simply, um, someone that's having stress, they may feel the stress as a pain somewhere in their body, right? Good example of that might be, a child that has two parents that argue a lot. And when they argue, it makes the child feel stress. And the child doesn't really know how to express that stress, right? So they might get a tummy ache, right? Right? They're expressing that stress through a body pain, right? They can't really tell their parents, "Hey, I don't like it when you argue." But she can't experience a stomach ache and go tell her parents my stomach hurts, right? And it really does hurt. She really does feel the stomach ache, right? But then maybe the parents stop arguing, right? And the cause of the stress goes away for a little bit, right? All right, but somatization, soma means body, right? So somatization just means you're feeling an emotion or a psychological stress in a body part, right? So your stomach hurts, your wrist hurts, you have a headache, right? Because of the stress, right? For stress headaches, right? You're just feeling that stress somewhere in your body. All right, sublimation, the transformation of unacceptable impulses or drives, such as aggressiveness, anger, sexuality, into a constructive or more acceptable behavior. For example, a person who has aggressive tendencies becomes a jackhammer operator, right? All right, another example might be, a child who has anger issues or is hyperactive, something like that, right? um right, it may not be acceptable to show anger, in maybe places like school or at home, right? So they take that aggressive energy and find some place that is acceptable to express it, right? uh so a child like that might get into something like football, right? Where there's a lot of aggressive physical contact, right? But that's an acceptable way, all right, to sort of have aggressive behaviors, right? Whereas it would not be acceptable to be aggressive, maybe to fellow classmate in the classroom, right? All right, so that's sublimation. All right, suppression, a conscious mechanism, right? A conscious or voluntary inhibition of unacceptable ideas or impulses or memories. For example, a child who fails algebra puts that event out of their mind, right? All right, so um, suppression, right? So if thinking about something just kind of makes you stressed, it doesn't make you feel well, Um, you're just gonna try not to think about it, right? Some people use the expression putting it on the back burner, right? So if there's a stressful thing, you're gonna try not think about it now when maybe you first experience the stress, right? But maybe you're telling yourself, I won't think about it now, I'm too stressed, but I'll think about it later, right? So they'll put it in the back of their mind, they'll put it on the back burner, they'll suppress the impulse to think about it, right? All right. They'll sort of push that memory to the back of their mind, right? When they're in a better position to handle the stress of thinking about it. All right, undoing. Actually or symbolically attempting to cancel out an action that was unacceptable. For example, is sprinkling salt over one's left shoulder to prevent bad luck after spilling salt on the table, right? Okay, so you're trying to, um, if you believe in luck in things and you think it's unlucky to spill salt, you try and undo that action and the bad luck that came with it, right? By then tossing salt over your shoulder, which some people think brings you good luck, right? All right, last one on here, substitution. Okay, this is replacing a highly valued, unattainable object with a less valued, attainable object. For example, the person who has a strong, unconscious sexual attraction to a parent married someone who resembles the parent, right? Okay, so you know, we can't marry our parents, but we can marry someone that looks like our parents, right? And so that would be substituting, right? Replacing something you can't have, right? With something you can have, right? All right. Defense mechanisms. They're all about finding some way to relieve the stress that we're feeling, right? Uh, it, there's just there's different ways of doing it, right? Okay, so you might want to know what these words mean, right? So once again, if you get a little time today, maybe after you've done those packets or while you're at home, look at these words and see if you can tell yourself what they are, right? Could you tell yourself what compensation is as a defense mechanism, right? Or denial, right? You may see some of these words on your test, right? So I would look them over. All right, conscious coping strategies. All right, these are purposeful behaviors used to make an unfamiliar situation into one that is perceived as more controllable or predictable. They are attempts to help people feel less stressed and anxious about their illness. Some methods provide only temporary relief, whereas others provide more permanent results. All right, and we've talked about some of those conscious coping strategies, right? Might be distraction, like watching television. Might be something spiritual, like talking to your religious leader, praying. All right. The thing with conscious coping strategies is we mean to do them, right? Okay, we mean to lower our stress by watching television or talking with a friend, right? Or um, reading a book, something like that, right? We mean to do them, they're conscious. All right, not all coping strategies are conscious. Yeah. Now, usually conscious coping strategies are a good thing, right? Sometimes the unconscious one aren't, some are, some aren't. All right, but usually if we're meaning to do it to calm ourselves down, it's usually a good thing, right? All right. So you guys, things like guided imagery, meditation, those kind of things, right? We're doing them consciously on purpose. All right, maladaptive coping mechanisms and strategies, all right? These are things that they're not going to help us, right? We're trying to relieve our stress, right? By doing some of these things, we think they might work, but they really don't, right? For instance, drinking, right? We may feel a little bit calmer, right? When we've had that drink, right? But then in the morning, we're going to feel worse, right? We might have a headache, we might have a hangover, that sort of thing. So in the end, they probably made us more stressed, not less stressed, right? All right, one maladaptive coping mechanism is helplessness, and this happens a lot in the hospital. Probably happens a lot in the nursing homes. This is when someone experiences a lot of events that they don't really feel like they have any power to change, right? Um, maybe they have diabetes and um, they've been trying to fix their diet and controlling their sugars and things, but they keep getting complications, right, of the diabetes, and maybe they get foot ulcers, they lose a toe, right? All these things are bad things are happening to them, and they feel out of control. So this may cause the person to want to regain some sort of control over something, right? So oftentimes when they're in the hospital, they'll be, uh, maybe very rude to nurses and other personnel that are trying to help them, right? The nurse might not have done anything, but uh, the person is yelling at them and being angry with them, right? And they're not really angry with the nurse. It's just that they feel helpless and yelling at the nurse, right? Maybe even telling her to do things, a lot of things for the person, right? Or telling the nurse that things aren't being done right, right? Um, gives that person a sense of control, right? Um, if you can yell at somebody, right? If you can get them to do things for you, right, by yelling at them, things like that, it makes you feel more powerful. It makes you feel more in control, right? So nurses tend to get those behaviors a lot. Patients yell at nurses, so do families. Families can feel helpless, right? Just keep in mind when these sort of things happen, it's not really you, right? It's just the patient feeling helpless, right? And they're trying to gain some control over their situation, right? Now, one way you can help families and help patients deal with this um, feeling of helplessness, right, is to give them situations, no matter how small, where they get to control something, right? They get to make a choice, right? Now, one thing we can do in the hospital, right, to give them choices is, maybe with their meals, right? A lot of hospitals have a list of foods that someone can have for breakfast or dinner or lunch. And so you can give this list to the patient and say, you know what, pick what you want for dinner, pick what you want for lunch, and so forth, right? Um, we're not just going to decide for them, right? There'll be different cards with different foods on it for the different diets, right? So even if your patient's on a clear liquid diet, right, they'll have some choices, right? They can have some broth or some jello, right? Point is, they get to pick the thing that they're going to have, right? And it gives them a little bit of control. All right, so offer choices to your patient whenever you can. Maybe even what time they want to go for a procedure, right? Okay, if they're going to have physical therapy, maybe giving them the choice of having it in the morning or in the afternoon, right? Letting them make a choice makes them feel a little bit more powerful, right? So these are some of the ways um, we can help when a patient has the feeling of helplessness, right? Give them choices and things. Okay, next up, powerlessness. Now, this is when your patient feels like no matter what they do, it's not going to help, right? So once again, that patient that has diabetes, um, if the things that they try they don't think have made a difference, right? Changing their diet, things like that, their conditions getting worse, right? They're going to feel powerlessness. All right. Now, when you're helpless, when you have helplessness, having choices and making decisions makes you feel better, right? Makes you feel less helpless. Like you're doing something, right, to make yourself feel better, right? Picking your own meals, you're picking your own times to go to procedures and things, right? You want to have these choices. They make you feel like you can make a change, right? Powerlessness is different. Powerlessness, you feel like you can't make a change, right? So you don't even want to have a choice because no matter what you choose, it's not going to do anything, basically, right? So if you do get a choice, you're like, I don't care, whatever, right? They don't want to make choices. Um, and they may even not want to go to procedures and things like that, right? Um, because they feel they don't have any power, and whatever they do, it's not going to make a difference, right? All right, powerlessness though is a coping mechanism because if you feel like no matter what you decide, nothing's going to change, then maybe you don't have to feel the stress of making decisions, right? Um, so powerlessness is sort of a coping mechanism, right? To You're trying to make yourself feel less stressed. But it's an avoidance mechanism, and usually avoidance mechanisms, they're not good, right? They're maladaptive. All right, so when a patient's feeling powerless, they're going to avoid decisions, right? They may even be in denial of their illness, right? But the main thing is that they don't feel their actions will have any effect on the illness, right? So they feel powerless. All right, but not having to make decisions, maybe they'll feel less stressed, right? And so they're having those behaviors, right? All right, healthy people 2030. Now, this is something that comes along every 10 years. It's produced by the National Health and Disease Prevention Initiative. And every 10 years, um, they do studies and things, and they study the population and how healthy they are, and come up with recommendations that will help the population be more healthy, right? Live longer. All right. They produce goals and objectives and strategies, right? And sometimes they meet their goals, right? Sometimes health in populations gets better, sometimes it doesn't. But the main thing is that they come out with one of these reports every 10 years, right? All right, so the National Health, Disease, and Preventive Initiative. Its goal is to increase the quality and years of healthy life, all right, and decrease health disparities, right? There is a lot of health disparities, right, in the United States, right, with access to health care, to health insurance, right? Um, some neighborhoods and things don't have very many clinics or doctors' offices or uh, hospitals and things, especially rural areas, right? So there is disparities in your ability to get healthcare and your ability to afford healthcare as well, right? Now, there are 62 topics with specific objectives and strategies, right? And they have objectives for many different things, right? Things they're going to think are going to help um, healthcare in the United States, right? I remember when I read Healthy People 2020, right? That was um, no, it wasn't even 2020. When I read Healthy People 2000, Healthy People 2000, one of their goals was to have 80% of RNs with bachelor's degrees, right? And they even recommended that hospitals only hire RNs with bachelor's degrees, right? And so I thought, well, that might be a thing. So I actually went and got a bachelor's degree. I just had an associate's, right? An associate's is a 2-year degree, a bachelor's is a 4-year degree. And so I did that because I thought, well, maybe they would meet their objectives and hospitals would start doing that. Turns out that didn't happen, right? Even today, we don't have 80% of RNs that have bachelor's degrees. A lot just have the 2-year degree, just have associates. Reason for that is if you get a 2 or 4-year degree, you still get to be an RN, right? There's not a lot of pay difference sometimes between the two, right? So people don't put the extra expense into getting that extra education, right? Because they still get to be an RN either way, right? And so that's what I did, right? I got an associate's degree and became an RN. Then I went back, right, when I read this, and I got um, the extra 2 years in, and I got a bachelor's, right? Point is that these goals and objectives, they're not always met. In fact, if they're not met, they're sometimes restated, right, in the next Healthy People, right? So we had Healthy People 2000, we had Healthy People 10 years later, 2010, right? Then we had Healthy People 2020, and now we have Healthy People 2030, right? Okay, some goals are reached, some goals aren't, right? All right, but they do these every 10 years, right? National Health Disease Prevention Initiative, right? All right, nursing process, right? If you can remember the order of these things, it'll help you maybe answer some priority questions, which are usually, students have a lot of difficulty with priority questions, right? And so if you do get a priority question, right, and one of the answers means that you have to assess something, well, that's probably going to be the priority because you have to assess before you do anything else, right? All right. So if you had a question, maybe somebody was having chest pain, and your answers were do an AKG, give morphine, put the patient on O2, right? Which one of those things is an assessment? Well, an EKG, right? It's an assessment, right? It's looking at the heart. That would probably be your priority, although you would do all of those things maybe if someone were having chest pain. But you're not going to give them morphine before you know what's going on, right? Uh, you're not going to give them oxygen before you know they actually need oxygen, right? Um, a lot of people want to jump to cardiac with chest pain. Maybe it's heartburn, right? We have to assess the problem first, right? Before we start doing interventions, right? So I would know nursing process, I'd know the order, right? Assessment first. Then we do our nursing diagnoses, right? Our patient problems, right? Then we make nursing goals. How are we going to fix the nursing uh, problems, right? Okay, the nursing diagnosis, right? So nursing goals and outcome criteria come next. And then lastly, we're going to do our interventions, right? Okay, and after we do that, we're gonna do this whole nursing process all over. Because after we do something, we have to do assessment to see if it worked, right? To see if it helped the problem, right? And did our intervention do what we wanted it to do, right? Did it meet a goal, right? So we just start all over, right? And maybe we find new problems, right? All right, but this is a continuous process. We're always doing it, but it starts out with assessment first, right? All right, question 2. Mentally healthy individuals are able to do all of the following except A, perceive reality accurately, B, think clearly and logically, C, communicate ineffectively, and D, develop a positive self-concept. All right, so I'll give you a second to think which one you would choose. All right, and if you chose C, that was the right one, right? Um, Healthy people will communicate effectively, not ineffectively, right? So healthy people will do all these things except C, right? Okay, they'll perceive reality accurately, they'll think clearly and logically, they'll communicate effectively, not ineffectively, right? And they'll develop a positive self-concept, right? They'll think well of themselves, right? If they're mentally healthy. All right, that does it for our slides. I will see you next time in person instead of on the screen, right? Hope you all have a great day.